Welcome, and thank you for joining us for our webinar presented by Quorum CVS Specialty Infusion Services, titled Fueling Resilience, Preparing for the Unexpected Throughout Your Nutrition Support Journey. Sharing a couple of housekeeping items before we get started. This is a webinar format, which means your camera and microphone will be off. We will only be able to see the presenters. While we will not be utilizing the chat or the raise hand feature, you can use the Q&A function in the toolbar at the bottom of your screen if you have questions during the presentation, and our presenters will answer them at the end of the presentation. This webinar will be recorded and made available on our website at oley.org/webinars. That's oley.org/webinars. And the information provided during this and all of Oley's presentations is for educational purposes and is not intended as medical advice. Although all clinical information is peer-reviewed, you're advised to always consult your healthcare team before making any changes to your care plan. To get us started, please allow me to introduce our speakers, Kathryn Troyer and Kimberly Smith. Kathryn has been a registered dietitian for 14 years and an advanced practice dietitian in nutrition support for 12 years. She practiced as an inpatient clinical dietitian for over 6 years prior to joining Quorum in 2017. Her roles at Quorum include being an infusion nutrition support dietitian, specializing in home parenteral nutrition therapy for 3 years, and then transitioning to her current role as National Nutrition Support Dietitian Supervisor. Kathryn oversees and supports the team of infusion nutrition support dietitians. Nutrition support has always been her passion, and she loves having the opportunity to serve HPEN consumers, home parenteral and enteral nutrition consumers. Kimberly Smith. Kim has been more than 15 years specializing in home enteral nutrition therapy. She spent the first couple of years in her dietetic career working in a hospital setting and then went overseas with her husband. Kim spent 2 years in England assisting patients with their transition from inpatient to home. After returning to the United States, she continued to pursue her passion in enteral nutrition therapy and is now an enteral nutrition support dietitian supervisor. Kim supports her registered dietitian team and other teams within the company so that their patients can have a smooth tube feeding journey. Kimberly is passionate about enteral nutrition, home care patients. We're very excited to have Kathryn and Kim with us today, and we would love to start by learning more about you. So before we kick off the education, let's start with a poll question to learn who you are. So check out the poll. It's coming up right now. So choose which is most applicable to you. Now we realize more than one may apply. However, just choose the most applicable. So are you an enteral nutrition consumer or caregiver, a parenteral nutrition consumer or caregiver, or a clinician that works with enteral patients or parenteral patients? And submit. So let's see. So far we have the majority of everyone at 60%. Enteral clinician, 30, now it's going down, 30% parenteral. We have consumers and caregivers on the call, 2% enteral, 3% parenteral so far. We'll give you guys another minute to answer. Okay, so we got 65% of you are clinicians that work with enteral patients, and about 30% that are clinicians that work with parenteral patients, and about 10% consumers overall, having 7% enteral and 3% parenteral. So now, without further ado, I will pass it over to you, Kathryn and Kim.
Tracy, thank you so much for that introduction, and for those of you that participated in the poll. It's really helpful for us to understand who we have on the call. Today's presentation, Fueling Resilience, Preparing for the Unexpected Throughout Your Nutrition Support Journey, will provide you with information so you can understand the rationale for product disruptions and their impact. You'll discover resources offered for product availability and management directives. And finally, you will learn how to prepare for the unexpected situations, such as delivery issues, product shortages, and even an emergency. There are several unexpected disruptions that both enteral and parenteral consumers may experience. These disruptions are often quite frustrating and can be challenging to navigate depending on your therapy. Local power outages, whether they be related to a natural disaster or not, will affect consumers that rely on pump and refrigeration for their therapy, especially if there's not a backup power source available. In the event of a natural disaster, such as a hurricane, tornado, earthquake, or even a fire, product delivery may be delayed across the country. There could be local delivery issues even when there isn't a weather event or disaster in your specific area that causes a delay in when your product and supplies are delivered to you. Paperwork can also cause disruptions. Clinical documentation or an authorization from insurance may be needed, and that can cause delay if you're resuming or starting a new therapy, have an adjustment to your therapy, or experience an insurance change. Then, sometimes product shortages are the culprit of the disruption. There may be times when consumers can anticipate a disruption and prepare, and other times where it will take you by surprise. To understand both enteral and parenteral shortages, it is important to know the different distribution channels. The distribution channels are hospitals, home care, and specifically for enteral, there is also retail or online space for some products. The reason it's important to understand this is because each channel will experience and manage shortages differently. For enteral, the availability of product across the channels and the priority given to the channels can vary greatly. Hospitals will often be given priority for high-risk formulas. Sometimes retail or online spaces are also given a higher priority compared to home care. You may see one channel, such as home care, experiencing a shortage when another is not. This can cause confusion and frustration for consumers in the home care space when their product that they were using in the hospital is not available via home care, or if they can find that product online when home care doesn't have access to it. A parenteral disruption is complex in that there are many individual parenteral components that can go into shortage simultaneously. Each distribution channel will vary with the type of products they utilize and the manufacturer that they order from. Home care may utilize more than one manufacturer depending on the component, and so ordering history does play a part in determining how much product the hospital or home care may receive. The consumer population, such as a pediatric consumer, may also play a role in how the product is distributed to different channels during times of shortages. This leads us to look at some of the factors that contribute to product shortages that are seen in both the enteral and the parenteral space. But before we do that, we'd like to take a moment to do a quick poll to see which disruptions you have encountered the most frequently.
Thank you, Kim. So we'll open it up to everybody. Please choose which disruptions you have encountered, and you can choose one or more that apply. Local power outages, natural disasters, delivery issues, delays in obtaining insurance information orders, or clinical information, or product shortages. And for the clinicians on the call, you can also enter what your patients have encountered and shared with you. I know power outages have been challenging with certain storms we've learned about and disasters, delivery issues. So please choose whichever apply to you. Let's see where we're at. Product shortages, 30%. Insurance delays, 20%. It's pretty even so far, with product shortages, not surprisingly, leading the way, and then tied for delivery issues and insurance delays, and then followed by natural disasters at 16%, power outages at 10%. I'll pass it back to you.
Thank you for those of you that answered that poll. It's evident that so many of you have experienced a disruption at some point, and one of the more common disruptions is in fact shortages. There are multiple factors that contribute to shortages. Keep in mind the information regarding product availability can change quickly, which can be a challenge for home care providers to manage. Demand shifts are often seen when one product either goes out of stock or is in short supply. This causes the demand to switch to another comparable product. When the demand shifts are rapid and unexpected, like in the case of a shortage or recall, it can also drain remaining stock in that comparable product. When we look at production capacity, many times consumers may think, well, why doesn't the manufacturer just make more product? Unfortunately, it isn't quite as simple as that. The number of manufacturing sites is limited, as is the types of products that they can manufacture. If production is affected for any reason, another site may not be able to pick up the slack so easily. It requires having equipment and staffing to increase the production needed to make the additional products. Even when the product is made, it may not meet quality standards and therefore the product would be discarded. Also, there are times manufacturers will have a voluntary recall of product. For packaging material and ingredient shortages, even today, manufacturers can have difficulty sourcing adequate amounts of packaging or raw materials, which can lead to products being discontinued. Discontinuing low-use products can improve manufacturing efficiencies, which will help support a healthy inventory of the remaining product offerings. Finally, consider transit times. It takes time to get the product from the manufacturer to the distributor before it's shipped to the consumer. On the enteral side, the manufacturer may have product available. However, it could be up to an additional 2 weeks for it to get to the distributor. On the parenteral side, there are more than 20 plus individual components, and each product component has its own lead time.
Parenteral nutrition shortages are certainly nothing new to healthcare professionals and consumers. Unfortunately, they've been a part of our reality for over 3 decades, dating as far back as 1988. And as a result of this fact, clinicians are very experienced with managing and navigating PN component shortages. The figure on the left shows that since 2010, nearly all PN components have been in short supply at least one time. And according to the FDA, new shortages of sterile injectables increased nearly 800% from 2006 through 2011. PN components, including dextrose, vitamins, trace minerals, and electrolytes, all fall into that sterile injectable category. And the time frame for resolution really has just depended on the ingredient and the reason for the shortage. Largely, the reason for the shortages in the early 2000s was because of market consolidation. So there were very few manufacturers for PN components. Additionally, we had the Medicare Modernization Act, which limited reimbursement from Medicare for many PN components if they were administered in a non-hospital setting. In 2008, there was a heparin recall due to the contaminant in the raw material used to make it. This then prompted the FDA to increase inspection of those manufacturing sites, and it resulted in a record number of warning letters being issued that necessitated a halt in production to address those quality issues. This then led to even fewer sites to manufacture those components, and it worsened the situation. Global events over the past decade have also affected the supply of PN components. Hurricane Maria, for example, it devastated Puerto Rico and ruined sites that led to many shortages, most notably amino acids. This led to an increased demand for amino acids from other sites, which only exacerbated the shortage. And while the FDA is here to support mitigating shortages, they have initiatives themselves that have led to some supply chain disruptions for PN components, such as the Unapproved Drugs Initiative, or UDI. Many components that were historically grandfathered were including selenium, multi-trace element, and dehydrated alcohol now had to be reevaluated, and it led to marketing delays and an increase in costs. Let's look at a few recent PN shortages from the last 5 years. Some of these may be familiar to you, some of these might actually be a surprise. Some shortages may be more notable to consumers as they impact what occurs in the home, such as having more clear bags if the lipid infusion days need to be decreased to conserve, or a change in the frequency of adding a component in the home, such as multivitamin, down to 3 days per week during times of conservation, or requiring additional monitoring from a home health nurse if there's a change in the type of lipid to one that is new to the consumer due to a lipid shortage. Most notably here is probably the ethanol locks. There was one brand of dehydrated alcohol that was granted what's called an orphan drug designation for a very specific cardiac treatment. This granted that manufacturer a 7-year exclusivity that prohibits anyone else from manufacturing the product through 2025. This caused the price to rise by 700%, which, as you can imagine, really made it cost prohibitive as an off-label FDA use for lock therapy, which is used to help prevent line infections. And then there was COVID-19, which really impacted the global availability of raw materials that we use to manufacture PN components, as well as supplies and the staffing needed for production and transportation of the components. This has had lasting downstream impact for several years. And then most recently, Hurricane Helene devastated a manufacturing site in North Carolina for PN components, including dextrose and sterile water.
Enteral shortages are less well documented compared to parenteral, and enteral management strategies are often left up to the provider. Over the past few years, the enteral shortages are more frequent, last longer, and result in more consumers being affected. We really started to see an increase in shortages around the time of COVID that correlated with increased hospitalizations, supply chain, and labor issues caused by lockdowns across the globe. 2020 and 2021 was characterized in home care by shortages in disposables as the hospital supply of syringes, extension sets, feeding tubes, and formula increased. In February 2022, one of the most pivotal voluntary recalls of infant free amino acid formula was announced by one of the largest manufacturers. The shortages were seen in hospitals, home care, and retail, which ended up making national news. In the retail space, shelves were cleared, and the public had a difficult time getting the formula needed to feed their child. We even had a presidential intervention to help get product into the country. What you may not have heard or realized is that the infant formula recall and shortages in 2022 led to additional shortages across both the pediatric and adult enteral space that continued into 2023. One of the many reasons for this was because manufacturers had to increase production of free amino acid infant formula, which meant that another product's production was decreased. In 2024, we saw a syringe shortage where the FDA was involved. Given the limited number of enteral syringes, the FDA's guidance didn't recommend a transition away from all enteral syringes manufactured overseas, but instead just certain manufacturers. We also saw pump and gravity bag shortages. There were allocations in the home care space, so patients may not have received their normal number of pump bags during that time. Supply availability will likely continue to see challenges as tariffs go into effect, since many supplies are actually made overseas. For home care, it's important to offer different brands of similar supplies so you have options if something goes out of stock. For consumers, this may mean that one month you receive one brand of something and the next may receive something slightly different.
Clinicians do not act alone when managing parenteral nutrition shortages. There are several governing bodies that serve as resources to both inform and guide them so they can make the most educated decisions. Aspen provides timely updates and guidance to clinicians on how to cope with PN shortages. They maintain a page dedicated to PN shortages with articles covering considerations and recommendations for managing a specific component shortage. The FDA maintains a database of known drug shortages that is available to the public. They receive information from manufacturers regarding current shortages, expected duration, and anticipated product disruptions. They also provide information regarding the response to how they're going to address the shortage and what they will try to do to prevent it from happening again. The ASHP, or the American Society of Health System Pharmacists, maintains information on existing drug shortages. The target audience here is healthcare providers. The ASHP is used to notify practitioners of a new shortage, the status of an existing one, as well as management resources. As we mentioned previously, shortages impact all healthcare spaces, and so it is important that clinicians implement shortage directives based on their setting and available resources. Clinicians also need to be mindful of their formula adjustments and if they will be covered by the insurance provider. CMS, or the Center for Medicare and Medicaid Services, outlines shortages and outages through Appendix A of the State Operations Manual. They require that hospitals have processes in place to address shortages. Medicare, as well as many commercial payers, have coverage criteria for home nutrition support, and no one can rely on an insurance provider adjusting coverage criteria during times of a shortage. So with all that to be said, adjustments to a PN formula is done with consideration for the individual. Safety is of the utmost importance for consumers, and there is no one-size-fits-all approach to adjustments to a nutrition regimen. Consumers should feel confident that their team is making safe and appropriate adjustments to their formula.
To create a sustainable plan, it requires regular communication and collaboration between the manufacturer, the distributor, the clinical team, and the consumer. The manufacturer determines the health of products as they are the ones solely responsible for curating the product. They are on the front line to be able to confirm the vital information that clinical teams need regarding product release dates, amounts of product being allocated, and recovery dates for shortages. The distributor will remain in regular contact with the manufacturer to learn product status updates. While some home care companies may purchase their products directly from the manufacturer and manage their own inventory, many home care companies utilize a distributor to manage and ship out inventory. When a distributor is used, regular communication is needed to review supply status, anticipated back orders, product release dates, and stock of comparable products in case there is a need to pivot. Understanding current usage of the product and comparing that against what is available along with the expected timeline to receive product allows the clinical team to determine a plan on how to move forward. Your clinical team may include an ordering physician, a dietitian, and for parenteral specifically, the addition of pharmacists and nurses. If a shortage seems imminent, the clinical team can verify and work with the manufacturer and the distributor on how product will be affected and what alternatives are available. When reviewing alternatives, the clinical team must consider stock of the alternative so it's not depleted as its usage increases. When products don't have an alternative, conservation strategies need to be implemented. This is necessary to ensure all consumers receive some of the product. Running completely out of the product can be far more detrimental than giving a smaller volume of the product, as with a multivitamin shortage for parental nutrition. With supplies, this could mean receiving less than you normally would, as seen with the enteral pump bag shortage. Consumers need to be informed if there are changes in their formula, especially with changes related to a shortage. The clinical team really relies on that consumer to voice questions and concerns and any tolerance issues that may be the result of changes in their therapy. There should be clinical support for the consumer when they experience tolerance issues. Remember, no one knows your body better than you, so it's important that consumers remain their best advocate for their health. Finally, consumers should ask when they place their next month's refill if their original product they use is available to order.
Let's go ahead and pause for another poll question.
Thank you, Kim and Kathryn. So this is going to be a yes or no question. Do you have a nutrition support emergency preparedness plan? Whether you are living with nutrition support yourself, caring for someone with nutrition support, or a clinician working with nutrition support patients. Ooh, this is interesting because it's close to 50-50. I'm very impressed that 50% of you have a nutrition support emergency preparedness plan. That makes me very happy. I'm sure that makes us all happy. 54%. I'll give it another couple of minutes. Now it's the majority of you have a nutrition support emergency preparedness plan. All right, we'll end it there. So we have 56% of you do have a plan, so greater than half. I'll pass it back to you guys.
All right, thank you all for participating in our poll. It's great to see that many of you do have a plan, but if not, that's what we're going to talk about next. If we've discussed at length how your clinical team prepares for the unexpected, but now I want to switch gears and discuss how a consumer can prepare. And there are several things you can start doing today to feel ready in case of an emergency. The first step is you're going to want to create an emergency plan for yourself. Create a handwritten list of all the people you may need to contact with their phone numbers, including your physician, home care company, nurse, loved ones, and friends. Have a list and address of local hospitals, shelters, and any other places that you feel you may need to go. And finally, create a list of the important items that you will need to take with you should you need to relocate. If there is a known natural disaster that you have time to prepare for, such as a hurricane, be sure to check and stay up to date on those evacuation protocols. There may be additional support for people that have medical devices that include enteral and parenteral nutrition. So it is worth asking your local officials and emergency personnel if there is any kind of support in your area. Consider obtaining a written letter from your physician who oversees your therapy that clearly communicates the need for emergency services to be restored for you and your medical devices. It's not a guarantee that you will receive faster service recovery, but it's certainly worth a shot to provide this letter and have it on your file for local power and utility companies. And last but certainly not least, have an emergency medical card that lists all of the important information that relates to your medical needs, including your name with address and phone number, date of birth, blood type, all allergies, your insurance provider, your physician and their contact information, any medical conditions or disabilities, medication list that includes your nutrition support therapy. If possible, an immunization record, any special equipment or needs, an emergency contact, and then your home care company and their contact information.
So let's look at some ways the enteral consumer can prepare. This isn't an all-inclusive list, as it really depends on your therapy and comfort. From my experience, in addition to some guidance from Oli, it's helpful to understand your tube and have a backup tube and extension if you replace your tube or have a button, have a backup power source, syringes for flushing, stomach care supplies, including bottled water, hand sanitizer, and possibly an enteral transition adapter, depending on if you use a legacy or infant connection. Your method of administration and formula will really drive how flexible your plan is and what you feel that you need to have on hand to be comfortable. For pump users, it can be challenging to ensure that you will have a backup power source available at the time you need it, which is why a gravity bag might be nice to have on hand. You could work with your home care company to see if this is something that they could provide. You'll want to work with your physician to really understand your formula, why you're on it, and what alternatives are appropriate for you. For example, do you blenderize your formula? If so, consider having some commercially prepared product available, as it may be helpful since cleanliness will likely be a challenge if there is a disaster. Do you use a standard formula that would have an over-the-counter alternative available? You'll likely need to be flexible with the brand and calorie strength. Do you have a specialized formula like a metabolic formula that may not have anything similar available over the counter? Does your prescription allow for an equivalent so that an alternative formula can be sent if there is one available? And what happens if you don't have access to your formula or any alternative? This is where it becomes extremely important to work with your physician to develop a backup plan. When no formula is available, adequate hydration really becomes key. And while it's not ideal to be without nutrition for a short period of time, the goal becomes to maintain hydration. So be sure to know how much fluid you require daily and if an electrolyte solution is warranted. Also, consider having a 2 to 3 day supply of product and order your monthly refill timely. Although the number of days between refill shipments is driven by your insurance company, many insurances allow a refill order to be placed when you have about 5 to 10 days worth of product remaining.
Consumer preparedness for parenteral nutrition largely surrounds the fact that compounded or custom PN requires refrigeration, a pump, and has expiration dates to consider. Ensure you have ice packs, a cooler, a thermometer, and extra batteries in case of power loss. If this does happen, keep the refrigerator door closed and keep track of how long the power has been off for 6 hours. PN can be held at room temperature for 24 hours after those 6 hours have expired. If the power is not restored, then you will need to work to find alternative refrigeration to store your PN. But in the meantime, you can transition your remaining PN bags to a cooler with ice packs. The PN needs to be refrigerated at temperatures between 36 to 46 degrees Fahrenheit. This is when the thermometer becomes key if storing your PN in a cooler to ensure it is keeping those bags at the correct temperature. The pump will run on batteries until you can find a location with power. So make sure you understand which type of pump you use, what kind of batteries it requires, and for how long they will last. Have your supplies packed up and at the ready in case you need to relocate. This would include your syringes, flushes, tubing, dressing kit, and pump. Ideally, you want to have 3 to 4 days supply of PN and supplies until a new shipment can be sent to you. And please be sure to review the expiration date on the PN bags and discard any expired product. PN has a beyond use dating or BUD of 9 days at refrigeration. The expiration date that you see on the PN bag is the last day that bag can be infused. The product is no longer stable after that expiration date. Some miscellaneous items to consider having on hand include flashlights with ample batteries, bottled water for hand washing, and hand sanitizer for safe hand hygiene. Keep your health information card, list of emergency contacts, and local hospitals handy in case you do need to relocate. And lastly, consider discussing with your physician and home care company whether having backup or an emergency small stock of IV fluids or pre-mixed non-compounded PN may be an option for you if there is a delay with getting your custom PN. So if your power is not restored and you do need to relocate, it's important that you understand the items needed to correctly pack and keep that PN cool to the correct temperature. I really want to emphasize that a cooler is a temporary solution to use to transport your PN. Please be sure to immediately transfer your PN to a refrigerator as soon as one becomes available. While using that cooler, be sure to keep it in the coolest area available and try to avoid leaving it outside if possible. Use that thermometer to periodically check the temperature of the cooler to ensure it's keeping that correct reading of 36 to 46 degrees Fahrenheit. To keep your PN at the correct temperature and avoid any breakage, you're going to want to have the necessary packing materials and layer those items correctly. So you're going to want to have ice packs and bubble wrap and pack in a sandwich-like manner. First, you're going to line the bottom of that cooler with bubble wrap. You're going to follow it up by 2 to 3 ice packs, then another layer of bubble wrap with the medication on top of that second bubble wrap layer. Put one more layer of bubble wrap over that medication. So just remember that the PN should be entirely covered by bubble wrap. Then add 2 to 3 more ice packs, followed by one final layer of bubble wrap. So just to recap all that information, you will need 4 to 6 ice packs. The PN should be completely surrounded by that bubble wrap. And there should be a layer of bubble wrap as the first and final layer in that cooler. So this is going to take us to our next poll question.
Thank you, Kathryn. I believe this is a true-false. So this is to test your knowledge. You could use expired product in the event of an emergency. So in general, expired for enteral, expired for parenteral. It looks like the majority, 97%, is saying false. I'm actually curious to the answer to this question. Maybe there's some variables involved. So can you use expired product in the event of an emergency? We have 95% who say false. 94. Oh, we have a little bit more saying true. So I'll pass it back to you, Kathryn and Kim.
Okay, thank you all for participating in that final poll question. The correct answer is false. Speaking specifically to parenteral, I do want to call that out. The reason that this is false is because the product is no longer stable after the expiration date. Remember that we have that BUD, that beyond use dating for PN of 9 days at refrigeration. So when you see that expiration date on your PN bag, just know that's the last day that you can use that. Okay, we will go ahead and move on to relocation tips. So if you find yourself having to relocate, and that requires flying, then there are preparation steps you can take to make that process as streamlined as possible. TSA offers support to flyers with medical needs through their TSA Cares program. There are 2 methods to outreach to this program. You can access an online form and fill that out, but just know that requires 72 hours notice. We know that may not always be possible, so otherwise you can also call TSA Cares at the number listed on the slide. This program serves as a method to alert TSA that you require medically necessary items and liquids so that they can make that security process as smooth as possible for you. Consider having a TSA disability notification card created that you can also present to the security officer at the airport. There is a website dedicated to TSA procedures for those traveling with medical conditions or disabilities. So I do encourage you to take a look at that site to help you prepare. If you have additional questions or concerns, you can also email the TSA at the address on the slide. Some final relocation tips that I will leave you with is regarding keeping your home care company and physician in the loop regarding your location. Please be sure to notify both parties of the new location, whether that be a hospital, hotel, family friend's house, or a shelter, and whether that location is going to be temporary or permanent. Provide the address and phone numbers for the new location, and if there are any special delivery instructions your home care company should be mindful of. If you are hospitalized, be sure to present your medical emergency card if you have one, and notify the hospital staff of your home care company so that they can contact them and receive those therapy details. It's also worth asking the hospital staff about their policy regarding the use of home therapy formula and supplies. In some cases, such as a natural disaster or extreme shortages, the hospital may have permission to temporarily lift restrictions. But no matter where you are, make sure to understand the capabilities of that place in terms of storage and handling of your therapy and supplies. And remember to advocate for yourself, as no one knows your needs better than you.
So remember, product disruptions are well known and can be managed successfully with good communication, collaboration, and preparation. There are many resources available to support and guide both clinicians and consumers to effectively manage disruptions. Preparation is key when it comes to the unexpected and really empowers consumers to be in control of their therapy. Finally, try to be flexible where you can and stay calm.
This slide, along with the next, are links to consumer resources that can be accessed starting today and help get you prepared and then during an actual emergency that will impact you and your medical needs. Especially for parenteral nutrition, it is important for consumers to know that they can and are encouraged to report an adverse event on their own behalf because of a therapy change due to a shortage. Event reporting raises awareness to issues that occur because of shortages and product adjustments. It helps drive change that it can impact future consumers as well. I surely hope this is never needed, but in the event that it is, please be sure to reference the last bullet point here titled Report an Error on this slide. And with that, we conclude our conclude our presentation, and we really appreciate everybody's participation and attendance. I will pass it back to Tracy.
Thank you, Kathryn. Thank you, Kim. We'll open it up to all of you for Q&A. So some of you submitted questions when you registered for this webinar. So we will address those. And then all of you who are on live, you can enter a question into the Q&A feature, and we will go through them from there. Let's see which ones we have here. Okay, so we have our first one. This will be, this can be for Kim or Kathryn. Do you have any tips on how to emotionally support patients and families who are on EN or PN?
So I would absolutely suggest joining maybe a support group to make some connections with others in similar situations. I know Oli also has a community of connections and ways you can connect with people on their website. There's also social media platforms that have focus groups and forums that you can join. And you could also work with your physician to see if there's anything in your local area that they're aware of. But I think the more support you have, the better that you're going to be, and you're going to have people to be able to go through those similar situations and see what's worked or maybe not worked for them. So I absolutely think that's great to do.
Thank you, Kim. And this next question is actually enteral and is also for you. Kathryn, did you have anything you wanted to add to that before I?
I was just going to echo the same thing Kim said. I think just, surrounding yourself around others who are going through the same thing as you, experiencing something similar to you, is so helpful, to just not feel alone, right, in that journey. And they may be able to provide you with additional resources as well, or different tips or tricks themselves. So just echo what Kim said there with connecting with others.
Perfect. And I'm glad that you mentioned connecting. We do have consumer connections every month. So at OLI, we have them and they're free to consumers and family members. So we have one every month. There are community connections, and you could find them at oli.org/webinars. You'll see them there. And so we have a question here for you, Kim. I recently went back on a feeding tube. I travel internationally periodically. With restrictions on liquids, I have to check nutrition with my baggage. Any thoughts on how to navigate this? It's not that unusual for bags not to arrive as planned.
Yeah, we definitely get questions like that, and that is a great question and can sometimes depend on where you're going and what products you're using and how long you're going to be gone for. There have been times where sometimes, depending on how long you're going to be gone for, a family member could receive that product and ship it internationally, and maybe a hotel or whatnot could get it. Depending on your therapy, you may be able to purchase some generic formulas over the counter, if you can use a standard formula. So I think it really depends on, where you're going, how long you're going to be gone for, and what formula that you need. So if you have a lot of options in formula and you don't have a standard formula, you could look to see with where you're going, what things that they offer over the counter, and if that's appropriate for you.
Thank you, Kim. And I should throw in there, if anybody has specific circumstances or questions and they'd want to talk to somebody else on a similar journey, you can always email info@oli.org as well. And we have many members who may be able to support, and OLI ambassadors. So info@oli.org if you ever have any circumstances or challenges that you want support on. We have another question here. So this one is for you, Kathryn. How often do the home IV infusion dietitians actually perform in-home visits? How often do you complete formal or regular patient follow-ups for those on home TPN?
It's a great question. And I would say it would depend on who is the nutrition support team following the consumer or the patient. Certainly, I can't speak for all home infusion providers. Some have dietitians on their staff, some may not. So what I would encourage is for you to find out which home infusion provider is providing the therapy, and find out what does that clinical team look like, right? Who is part of managing that TPN therapy, and if it is a dietitian, finding out who they are, and just getting really close with them and finding out how often they're touching base with the patient to do assessments. So I would say getting to know your individual home care provider on that front to find that specific information out, as it will vary depending on the company.
And as we mentioned before, you as the consumer are your best advocate. So if you feel like you have questions or you're not tolerating something, then definitely reach out.
Mm-hmm.
Appreciate both of you. Great answers. Kathryn, we have another PN one. So I'm going to throw this to you. So what do you suggest if your DME or home infusion company isn't working with you during shortages, or the patient's being left in the dark to the shortages and not told when changes are being made to their PN, and it just happens without patient knowledge?
Mm-hmm. Yeah, that's an unfortunate situation. I would say that shouldn't happen. There should be clear communication amongst all parties. The physician, the home infusion provider, as well as the consumer, they're all part of that team, right? They all need to be in clear communication with each other. So I would say, again, if you're not getting the information that you feel you should be getting, or you have concerns or questions, that should be raised with the home infusion provider, that clinical team, and connect and make sure that you get answers to what the shortage is. Why is there a shortage, right? Understanding the why is so empowering and important. And then again, like giving your feedback as to how you're tolerating any changes to your therapy and if that's not working, so that the clinical team who's managing your therapy can know if there should be something changed, something different. So I would just say making sure that you connect and outreach directly to be your own advocate, as Kim already mentioned, to ask the why and to understand, and communicate if that's not working for you.
Thank you, Kathryn. And if you don't mind, I can also add that if there's somebody at your DME or home infusion company you don't feel like you're being heard, you can absolutely ask to speak to someone else on the team. You could ask to speak to a supervisor, such as Kathryn, you and Kim, and you can ask to just keep reaching out to different people on the team as far as your healthcare team as well. So your home infusion team and your home healthcare team with your clinicians, your physician and dietitian if you have one. It's always good to keep seeking out until you feel heard. So thank you for that great
100%.
question. Thank you. Now we have another question that just came in. And Kim, this is for you. Caregiver, so this is a caregiver for a new feeding tube consumer. What can I do to what can she do, he or she, to put a plan in place?
Yep, great question. So I would go back to that slide that I referenced, but really understanding your formula and why you're on it is going to be super important. So that way you know how easy it would be to get an alternative formula, possibly over the counter. And at the end of the day, it's always important to have kind of that backup plan, or some doctors may refer to it as a sick day plan. So that way, if you don't have access to your formula for some reason, whether it's a disaster or a local delivery issue or any of the reasons that we talked about, then you have a plan in place and you know how much hydration you need. Because if you think about it, if any one of us on the call is sick, usually clinicians don't really tell you to worry about forcing yourself to eat. They tell you to hydrate. So that really, goes into factor for our enteral consumers as well, that if they don't have access to their formula, hydration is key. And so I think besides knowing if your formula or an alternative formula is available over the counter, making sure you really know and understand how much hydration and possibly electrolyte solution that you need is important.
Thank you, Kim. And we have a little pause on questions. So I'll give a minute if anybody else has any other questions they want to enter in the Q&A. So go ahead and use the Q&A feature if you have any questions, comments, and while you're entering, I will just share if there's any questions that we cannot get to today, or if you have a question after, please feel free to email info, I-N-F-O, @oli.org, and we can work to get your questions answered. So I think we have a stoppage to the questions. I don't see any more coming in. Before we close, Kathryn and Kim, I will ask each of you if you have any last words of advice regarding shortages and resilience. So I'll pass to you first, Kim.
We really hope this presentation has empowered you to kind of understand what some of the disruptions are and ways that you can prepare for them, and just really being your own best advocate and making sure that you speak up if something isn't right or you're not tolerating something amongst all the shortages or disruptions is super important.
Yeah, I just echo a lot of what Kim said as well. And, for clinicians too, specifically, we hope now you have the tools and information to help navigate through any shortages or disruptions with your patients, so you can have good dialogue about how to prepare, because you can start preparing today, right? right? And, hopefully that time doesn't come where you need to implement those preparation strategies, but at least now, both you as a clinician, you can know what to expect to get as questions and items to help prepare your patients so that, they are well equipped to handle their nutrition during, an emergency or a disruption in service. And again, too, like as Kim said, for our consumers, just now knowing like power is in your hands, you can be your own advocate, voice what doesn't feel right to you, what's not working, or if you need more information, right? You have your clinical team, you have your physician, your home infusion provider, use them and work together to collaborate to make sure you have the right plan for you.
Thank you both. Thank you, Kathryn, and thank you, Kim, for sharing your time, your expertise, your experience, a combined 30 years of experience in nutrition support. This was incredibly informative and helpful. Thank you all who attended live. Thank you who will be listening to the recording. This recording will be made available on our website at oley.org/webinars, oley.org/webinars. For those dietitians joining us seeking CEU credit, there will be a follow-up email and survey to complete after the webinar. And once you complete the survey, you will get your certificate. If you have any questions, if anyone on the call has questions, you can always email info@oley.org. And if you're not already, please follow Oley on social media, on Instagram, Facebook, and LinkedIn. And to join our email list, you could become a member for free. Everybody in the nutrition support community can become a member for free. Just go to oley.org and you can join. And if you're not already receiving our updates, you can get them via email and when you follow us on social and going to our website. We have a lot of great events planned throughout the year. We have webinars such as this. We have community connections where consumers and caregivers can get together monthly as well. And everything is at oley.org/webinars. We also have in-person events planned. Our annual conference is always very, very popular. This year it will be in Charleston, South Carolina from June 17th through 20th. Please spread the word. The greatest thing about conference is that everybody gets to meet others who are on a similar journey, and it's always free for consumers and their families. So please spread the word, June 17th through 20th. It's an amazing opportunity for nutrition support consumers to connect and caregivers to connect. The registration is completely free of charge, only travel, and there's also an opportunity for travel grants on our website until April 18th. So again, thank you to Kathryn Troyer, Kimberly Smith, and Quorum CVS Specialty Infusion Services. Thank you all and have a wonderful day, everyone.